Hi, and welcome everyone to the International Interprofessional Mentorship Group. My name is Dr. Kate Barlow. I am going to be the host and presenter of this meeting today, April 6, 2022. And today we're going to be talking about developmental monitoring and pediatric practice settings. So for today's objectives, I'm hoping that everyone will be able to support families using the CDC's free developmental monitoring tools from the program Learn the Signs, Act Early. And I'm also hoping that everyone will have a good understanding of the difference between developmental monitoring and screening and really understand the importance of doing both. So the CDC's Learn the Signs, Act Early program improves early identification of children with developmental delays by really facilitating parent-engaged developmental monitoring. So hopefully children will receive services as soon as possible. So the CDC created this program because the CDC estimates that for children in the birth to 3 range that we are currently missing more than half of the children that need services. So more than 50% of children who have a developmental delay and need services are currently not receiving them. So we really want to increase our efforts for early identification. It is estimated that approximately 1 in 6 children ages 3 to 17 has a developmental disability, and 1 in 4 children ages birth to 5 are at a moderate or high risk for a developmental, behavioral, or social delay. Also of a concern is that children with autism spectrum disorder are still not being identified until around age 4, despite parents talking to their doctors or noting concerns around 18 months. So the Learn the Signs, Act Early approach is parent-focused. It uses high-quality, evidence-based tools. The pictures are all friendly and positive, and it's really focusing on the developmental milestones. So in the United States, each state has an ambassador, and the larger states have more than one. And we also have ambassadors for some of the territories like the Virgin Islands. And our job as an ambassador is to really get everyone using the same language and the same tools. And that is from pediatricians to healthcare professionals, OTs, PTs, SLPs, to everyone in EEC, your Head Start, your preschool teachers, your at-home daycare workers, as well as your pediatricians, developmental pediatricians, and your parents. So we really want everyone sort of using these same free tools to help identify children in the community. And this is a communication tool. So the Learn the Signs, Act Early Developmental Monitoring Program is really a public health communication tool to help parents identify when children are not meeting their milestones to helpfully then receive services if needed. So the American Academy of Pediatrics recommends surveillance, and there are six steps for doctors to take to order to do surveillance. So the first would be that they review these developmental checklists that we're going to talk about today, and this is considered monitoring. They ask the parents about concerns, they do an assess of strengths and risks, they might observe the child, they document, and then they're going to share the results with parents, teachers, at-home daycare providers, etc. So developmental monitoring is what we're talking about today, which are public health tools to help improve communication about a child's development. And developmental monitoring checklists can be completed by everyone in the community. So librarians and social workers and parents and OTs and pediatricians. Where developmental screening can only be done by physicians, clinicians like OTs and PTs, and teachers with specialized training. And when we do a developmental screening, we're really using a validated screening tool that will give us where children fall in respect to their same age peers. So developmental monitoring does not replace developmental screening. In fact, the research has shown that best practice is combining both developmental monitoring with developmental screening. So in fact, developmental monitoring efforts hope to increase the amount of developmental screening that is currently being done. The American Academy of Pediatrics recommends a schedule of child well visits, and this is the schedule here. So families are asked to take their children to the doctor at their first week, at 1 month, 2 months, 4 months, 6 months, 9 months, etc. However, the child is only recommended to be screened at 4 times that you see highlighted between birth and age 5. So the efforts of developmental monitoring are to have parents be aware of developmental milestones, because unless the parent has a concern, the child will only be screened these 4 times. So we know sometimes there are concerns before 9 months, and there are also concerns between 2.5 years and when a child starts school around age 5. So we want to make sure that we are reviewing milestones and making sure that if there are concerns, that the parents are bringing these concerns to the pediatricians to increase the amount of screening that is being done, so that there will be more screening other than these 4 times. So the Learn the Signs Act Early program that's offered in this by the CDC has a lot of different free materials to facilitate this developmental monitoring. So they have a growth chart, there's a digital toolkit, there's a bunch of tip sheets, there's the developmental checklist, there's free books, and everything can be found and printed online on the CDC website. We're going to spend some time talking about the app because I think that would be most appropriate in this international environment. But a lot of the checklists have also been translated into different languages. So if there is a language that you need or want and you're not able to find it, please email me and I can see if there is a copy amongst the ambassadors somewhere that might be an unofficial copy. So sometimes a parent or a therapist from a different country will translate the checklist, but it just hasn't been CDC approved. There are currently 6 different languages that are approved by the CDC, and they are on the website. But like I said, there are sometimes other translated materials that I may have access to. So let's briefly take a look at the difference between monitoring, screening, and evaluation. Okay, so if we're taking a look at monitoring, when we study milestones as therapists, we're looking at what children do around the 50th percentile. So around the 50th percentile at 6 months of age, a child begins to sit without support, they can bang 2 blocks together, and they're able to pass an object from one hand to another. We would refer to that as transferring an object. When we do developmental monitoring and we're looking at these monitoring checklists, it's going to have a group of milestones per age that says, if your child can't do this, then please talk to your doctor. So on the 9-month checklist for developmental monitoring, it'll say, please talk to your doctor if your child doesn't sit without support, doesn't bang 2 blocks together, or doesn't transfer a toy from one hand to another. So when we're looking at the milestones on the monitoring checklist, 75% or more of the children can already complete this task. Therefore, if a child isn't able to, then you would want to refer that child to the pediatrician. If we look at the Denver 2, which is a popular screening tool that's been translated in a few different languages, I think like 20-something languages, they have that 75% of children can transfer an object at 6.8 months, and 90% of children can transfer an object at 7.7 months. So again, when you're monitoring, this is a public health tool. It's public health, it's a communication tool to use with parents. So on the 9-month checklist, it says if the child doesn't transfer an object from one hand to another, you should please go talk to the doctor. Keep in mind, that's because that one skill is really late, right? So if 90% of children can transfer at 7.7 months, and at 9 months, this child is still not transferring, maybe there's an undiagnosed case of cerebral palsy here. Why is that child not using one side perhaps? So really feel confident that when the checklists say refer the child to the doctor, it is legitimate. Here I have a screen that has monitoring, screening, and evaluation, and we are just going to take a look at the 3. So when we're looking at monitoring, here is a list of some motor skills that we're looking at. And this is on the 6-month checklist. So this would be used for children who are 6, 7th, and 8 months of age, because there is a 9-month checklist. So when you're looking at the checklist, you're always going to use the younger age. So if a child falls between 2 different checklists, you're going to use the younger checklist. So on the 6-month checklist for monitoring, we're going to see things like, please contact the doctor if your child isn't putting things in their mouth to explore them, isn't reaching to grab a toy, doesn't roll from tummy to back, doesn't push up with straight arms when on the tummy, or doesn't lean on hands to support self when sitting. When we look at a screening tool, and I have the SWIC up here, so the Survey of Wellbeing of Young Children, which is a free screening tool, which I have the link for you later on. That comes in, I think, about 15 languages. So the SWIC is a great tool to advertise internationally because it comes in so many languages. So for screening, now when we're looking at screening, we're looking at skills that are around the 50th percentile. So it's 6 months, making sure children are picking up food and eating it, transferring an object, rolling over, pull to stand, getting into sitting position, and bangs 2 objects together. So when we're doing developmental monitoring, if we have concerns, we recommend a screen. When we're doing screening, if we have concerns, we then recommend an evaluation. And so when we look at what's asked of a 6-month-old for evaluation, now we have this whole list that you see here on the right column for skills recommended for evaluation. So again, look at this long list of skills we're looking for at 6 months, and then what we're looking for at 7 months, and we're looking at 8 months. A lot of times as an ambassador, someone will say to me, well, what about culture? You know, it's part of their culture that the mom dresses the children, or they don't use spoons, or they don't use forks, or, you know, they're not meeting this milestone. I think it's cultural. And that's absolutely fine. Sometimes it actually is cultural. But when you're using these checklists, this is just a snapshot of skills. So I always recommend that if a child isn't meeting one of those skills, you then refer. So if you're monitoring and the child isn't able to do something, you still go ahead and recommend a screening. Or if the child isn't doing something on the screening and it's of a concern, you would still recommend an evaluation, because an evaluation is a comprehensive assessment that will really determine whether or not it is cultural. Because sometimes a small child might not button their shirt, let's say, because the mom dresses them, because it is cultural. That's absolutely fine. But then that child is not going to, the child will then be able to do the other array of fine motor tasks that use similar coordination and motor planning, such as buttoning. So we don't want to not refer a child because we think it may be cultural. We always still want to refer because the mom may be doing it because it's cultural, or the mom may be doing it because the child has such a difficult time doing it that the child isn't able to. So we always want to refer just to be on the safe side, because a child is never going to get services if they don't need them. So we just want to make sure that we are recommending the comprehensive assessment to rule out whether or not the child actually does have an underlying deficit area in that particular area. Okay, so the takeaway for developmental monitoring is to really be confident. If a child is missing a milestone and then you ask the parents to contact the doctor because of it, you can feel confident about that because that means that that skill is really late and it does warrant further investigation. So we're going to talk a little bit about some of the tools now. So these milestone moments booklets, so some of you that are very, very far away and are not going to have anything shipped to you, you can go online and print these materials for free. This is also why I love the app, because the app is just so easily accessible. But these milestone moment booklets have all of the checklists inside of them from 2 months to 5 years of age. And these booklets come in English and Spanish. What I really like about the booklets is at the very end of the booklet is a screening log. So for families that have unstable housing, or you know that they're moving around a lot, keeping a list that they can take with them of when their child was screened is really important. The CDC checklists are at the 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, et cetera, and goes all the way up to 5 years of age. There are about 13 milestones on each checklist. And when you're asked, you're talking with a parent, it says, is your child able to do this? When you're online filling it out, online or on the app, the choices are yes, not sure, or not yet. So if the parent is not sure, you would want to really look at that milestone, try to facilitate that milestone, give the parents 2 weeks to really try to see that milestone. And then the parent isn't seeing that milestone within 2 weeks, you want to definitely go ahead and refer to the doctor. So for each checklist, it will say, if your child is not meeting one of these milestones, please go see the doctor. So just as a reminder that these checklists are of milestones that 75% or more of children are able to do. So if a child is missing one of these milestones, you want to definitely refer them for further screening or evaluation. These checklists, just also as a reminder, they don't diagnose, right? We're therapists, we can't diagnose anyways, but they're not indicators of disability or delay. And they're not therapeutic guidelines. They're public health communication tools. So really just keep that in mind. So on the website, there are also these 3 books. The Baby's Busy Day has a bunch of milestones for the 1 year age range. The Where is Bear is a book about 2-year-old milestones, and Amazing Me is a book about 3-year-old milestones. There's a bunch of tip sheets on the website online. There's a tip sheet about the difference between monitoring and screening. There's a tip sheet about how to talk to the doctor. And there's also a nice tip sheet there about how you can help your child from a parent point of view. Okay, so my favorite is the CDC Milestone Tracker app. And if you haven't already downloaded that on your phone, if you could please go ahead and do that. It'll only take a minute. And it is fantastic and free. And like I said, it does come in English and Spanish. All right, so if everyone can go ahead and pull up the app on your phone, we are going to go ahead and practice using the app. So if you go to the Milestone Tracker app and you pull it up on your phone, it will say, which language do you want, English or Spanish? And then you are going to add a child. So I'm going to go ahead and do this at the same time so that I know approximately how long it will take. So I typically just enter in the child's first name, so Lucas, and then their date of birth. And here we're going to do May 25th. 2021, hit done. Was the child premature? We're going to say no. And we're going to say this child is a boy. And then we'll scroll up and hit done. And you'll see that it says Lucas is 10 months old. However, because there's not a 10-month checklist, there's a 9-month and a 12-month, we are going to go ahead and complete the 9-month checklist. So when you scroll up from there, it will say Milestone Checklist 0/13. Go ahead and click the Milestone Checklist. And at the bottom, it says Start Tracking. So here are the questions that you would go through with your parents that you're working with or children in the community. So is your child shy, clanging, or fearful around strangers? We'll say yes, and then scroll up. Shows several facial expressions like happy, sad, angry, and surprised. We'll say yes. Scroll up. Looks when you call his name, we'll say yes. But let's say we weren't sure. See how you can say not sure? You could actually put notes in there. So like doesn't call, when I yell at his name, but will, turn when he hears loud music or something. So if you wanted to put notes in, let's say that the parent is going to the doctor's and you're not able to go, you could put little notes in that little section for the doctor to see. The next one says reacts when you leave, such as looks, reaches for you, or cries. We'll say yes. And then the next one, smiles or laughs when you play peekaboo, say yes. And now you're moving on to the language section. So the milestones are makes different sounds like mama and baba, we'll say yes. Lifts arms to be picked up, yes. Now we're moving to the next section. Looks for object when dropped out of sight, so that object permanence, right? We'll say yes, moving along. Bangs two things together, yes. Next section. Gets to a sitting position, we'll say yes. And then moves things from one hand to another, yes. Uses fingernails to rake food, we'll say yes, and sits without support, yes. So now we move to the next section, and this is now just open-ended questions to try to see if parents have any concerns. So my baby has lost skills, or I'm concerned that my baby isn't doing something I expect them to doing. I have concerns about my baby, the way they play, learn, speak, or move. I have concerns about other things my baby does. So these extra open-ended questions really allows, maybe there's a feeding issue, right? So this would be where you could put in the feeding issue, and then you would hit my child's summary. And then this, as you can see, if you scroll down, it says email summary. So you could have this summary email to the parent, email to the doctor, or you can hit show doctor and it gives another summary of all of the different milestones. So it really takes, less than 5 minutes to complete with a family. It's a great way to engage a family about the development, especially if you're new to that family. And it allows you to not have to be the expert. So if you don't have very good rapport with the family and you're afraid to say, I think there's a problem, you could be like, well, the CDC is recommending that you talk to the doctor about this concern because the child should be achieving this milestone and they're not. So the doctor will be able to explore maybe why the child isn't reaching that milestone. So, sometimes when we're working with a family, the rapport is really most important. So if you're feeling concerned that having that conversation that there's a problem is going to ruin that rapport, you can always put the blame on the CDC. It's not me saying that there might be a problem. It's the CDC saying that there's going to be a problem. Yes, I will be sharing these slides and the presentation after after I upload it. So within like 48 hours, I will send out the slides and the recording. Great question. All right, so when you're on the app, if you hit the back sign, it'll eventually take you to the hamburger, right? The 3 lines on the top left. And when you hit the hamburger, you'll see as you look down the different options that there's tips and activities. So if you hit the tips and activities, it'll give great recommendations for parent engagement. So maybe there's a babysitter coming, or grandmother's new to being a caregiver of her, her grandchildren, and she hasn't done work, played with a 9-month-old in a really long time. So this tips and activities is a really nice way to say, here are some activities that you can do. If you visit the family once a week or once every other week, you could say, here's a bunch of activities that you can do with your child until the next visit. So it's a nice option. All right, so the second baby that we're going to do is a premature baby. So most of the families that we work with have more than one child. So we would definitely want for the family to monitor all of their children. So if you go up and you tap on Lucas's name at the top, you can see that there's going to be a space to add another child. So we're going to go ahead and add another child. And this is going to be baby Jordan. This is actually one of my students' babies. And the date of birth of this child is July 3rd, 2001. And by the way, if any of you want to email me pictures of your children, I would absolutely love it because I need lots of baby pictures from birth to 5. And most of my family is all white female, and we have a ton of blondes in our family. We do have some boys, but we have a lot of white blonde children in my family. So it's nice to have diversity and pictures of lots of different looking babies. So if anyone wants to send me pictures that I can use in my presentations, I would greatly appreciate it. Okay, because not all babies look like me, right? All right, so anyway, so this child is born July 3rd, 2021. You're going to hit done. And was the child born premature? You're going to say yes. And for the number of weeks, you're going to say 5. And this is a girl, and you're going to hit done. And remember that typically most pediatric assessments that we use will correct for prematurity until age 2. So this is really nice that it's able to correct. If you don't know whether the child is premature or not, that's fine. We would just enter in their birth date. Because remember, when they go through a comprehensive evaluation, they would correct for prematurity typically until age 2. And so again, a child is never going to receive services if they don't qualify. So if they fall within that 25 to 75th percentile when they get a comprehensive evaluation, they would not qualify for services. All right, so we are going to take a look. It says Jordan is 9 months old, but because this little baby girl is premature, we're going to use the 6-month checklist. All right, another really neat feature on this app is the add appointment. So for those of us that do home visits, we always schedule our next appointment when we leave. I want you to scroll up to the bottom and where it says add appointments, and you can click on that add appointment feature. This will give the family a reminder of your upcoming appointment, which is really nice. So this is actually a parent meeting that I have. So I would type in, parent meeting, and the date is April 14th. So you can go ahead and put that in. And the time is 4 p.m. Now, this particular meeting of mine is over Zoom, so I can put the link right there into the chat. However, when I do my community visits for my feeding practice, I'll put right in the notes, please have the child be hungry. And instead of the provider named Kate, I'll typically put like feeding therapist, because some families have multiple clinicians coming into their home and sometimes they confuse us. So I always want to put feeding therapist so that they try to help them. Oh, right, the baby's supposed to be hungry when I come into the home. But if you hit add appointment, and you go back to the home screen, you can see that the parent meeting shows up nice and big at the bottom of the app, which is really nice. And they will get an appointment reminder as long as they permitted that in their settings feature. All right, so this is for baby Jordan. And let's just say you're talking with a family and Jordan's dad says, Jordan isn't rolling over yet, and she really doesn't show a lot of affection. And let's say you're like, oh my goodness, I really don't remember when children are supposed to roll over, right? You can always just go to the when to act early feature. So if we're back on the app and we go to the hamburger, and one of the choices when you look down says when to act early. So if you look at things here, you can always remember you can type something in. So if you're not sure, you can type that in, and then Jordan's dad would bring that to the doctor the next time. But you can also go to the Milestone overview button, and you can just move to the movement tab, and it'll show you when a child is supposed to be doing something. So if you look at the 6-month tab, it says rolls from tummy to back. So if a child isn't rolling from tummy to back, then you would want to refer. And so if Jordan's dad is saying the child isn't rolling over and you're completing that 6-month checklist, you would go ahead and refer. So the Milestone overview checklist, the Milestone overview is really nice because if you're just concerned about speech or you're just concerned about motor, you can just look at those specific skills, which is really nice. Okay, so that was what I was just talking about there. The hamburger sign is really nice in order to move around. So again, if you please play with the app on your own time to see all of the really nice features. What I'd like to do right now is talk about a little bit of the different places that we work in pediatrics and really how you can use developmental monitoring within these different practice settings. So the hospital inpatient setting, if the child is coming in typically for a shorter period of time, and then when they're discharging, it's really nice to allow the parents to have something to empower them to really continue to monitor their child's development as they're leaving the hospital, especially if you're working in the NICU or if you're working with a brand new baby. So if you can get into, the clinics or with maternal mental health or any type of brand new, when a baby has just been born, is really the ideal setting to educate families about the app so that they can continue to monitor their child's development. In the outpatient setting, the child's typically already been identified as having a concern. That's why they're seeing you. So I really like to use developmental monitoring with families, like the books or the activities for things that they can do in between visits coming to see me. Or I really like to use it when I discharge the family. So let's say they've come to see me and now they're 2.5 and they're being discharged. I would want the parents to continue to monitor that child's development until the child was 5 years of age. In the early intervention setting, that is a setting for family. In the US, we use early intervention as a term for children birth to 3. And again, in this setting, the children have already been identified, but a lot of times when families come and ask their child to be evaluated, the child isn't found eligible for services. So they didn't fall beneath the 25th percentile for their fine motor skills or their feeding skills, right? And so this is a great time to teach the family about developmental monitoring, because even if the child wasn't found eligible right now, let's say at 2 or at 4, as the child continues to grow, if there is a small deficit, the deficit will just get larger and larger as the child grows. So we want those parents to continue to monitor. So for children under 3, if they're not found eligible, we would say, come back in 6 months if you still have concerns. So this would be a great way for families to track, right? Could continue to monitor your child. If you still have concerns, come back in 6 months. For a child that's over 3, we would say come back in a year. So if you still have concerns, come back in a year and the child can be reevaluated. So sometimes when children aren't found eligible for services, educating parents on how they can continue to monitor their child's development is really key. In a school-based setting, it depends on the age of the child that you're working with. The program only goes to age 5, but here in the US, we have a lot of children that are in the school system from ages 3 to 5. And so again, this is a really nice way to teach families about milestones using the books and the growth chart to engage families in activities that they could be doing with their child at home. And also, if a child was not found eligible for services, we could provide them with the information on developmental monitoring so that they would feel empowered to come back and ask for another evaluation if warranted. The biggest area that I see monitoring is within community prevention. So that's really a large amount of the work that I do here in the US is community prevention. So I want librarians and daycare providers and really everyone in the community using this tool and monitoring children, looking at their milestones so that they feel knowledgeable about the children that they're working with. Sometimes you have a new family. The Head Start that I work in has a huge migrant population where the families have just moved from Guatemala. And from what I'm told, this term milestone, it's really new and they're really not familiar with it. So even though their child doesn't necessarily have any kind of a delay, these children are 2 and 3 years of age and they've just moved here to the US. And so this is what a great way for parents to be educated about milestones, to be educated about appropriate activities to play with their children, and also to monitor, to watch for concerns. So if there was a concern, they would have the language and the ability to go to the doctor and say, the CDC says my child should be doing this and they're not. So So, you know, let's take a look at that specific area where the child isn't performing well. I think for a lot of people in the US, if English is their second language, it makes it that much harder for the families to communicate their concerns about their child to the physician. And so these developmental monitoring checklists really provide them with that skill and that language that they need to really express their concerns to the doctors to hopefully then get the services that they need. So there's a lot of great ways that you can use this. So I promised I would tell you about the SWIC. So the Survey of Well-Being of Young Children is a free online screening tool that clinicians, all of us, can use. There is training modules online, which are also all free. And I did post all of the different languages there on the side that you can see that it comes in, as well as English. The Survey of Well-Being of Young Children has all of these different forms, and the forms are the same age forms as the Developmental Monitoring Learn the Signs Act Early checklist, which is really great. The Ages and Stages questionnaire is probably the most translated screening tool that I know of. So I've seen the Ages and Stages used in a few different countries in Africa. And I just wanted to compare the SWIC and the ASQ for some of you who may be familiar with the Ages and Stages questionnaire. They both have the months, but the SWIC is a little bit faster to administer. And they have, the SWIC has 12 forms where the ASQ has 21 specific forms. And I just want to note that the SWIC is free, unlike the ASQ. So for those of you who may be trying to run your department, right? Maybe you're the director of your department and in charge of the accounts payable. The SWIC is a nice free option, but both the ASQ and the SWIC have good validity and reliability. So they're great tools. One of the things I just wanted to mention before we wrap up here and move to questions is that sometimes doctors are really unresponsive to families when they're voicing their concern about their child's development. I particularly hear that a lot. You know, I told the doctor I was concerned, but the doctor said, oh, you know, come back next time, really taking like this wait and see approach. Let's see if there's any changes the next time that you come. This can be really upsetting for parents. And I just really want you all to know that sometimes you are really the parent's best supporter, right? So it's really important that we empower the parents to really feel that they know their child best and that they should continue to try to advocate for their child to get the services that they need. In the United States, families do not need a referral from the doctor to get early intervention services, which is birth to 3 services. But again, that varies from country to country. But if there is a way for families to try to get evaluated without a doctor's referral, then I would recommend that if the doctor is not being responsive to the parent's concerns. But when parents are not being heard by the doctor, I think it's really important that we just support those families, support them as best as we can, and really let them know that they know their child best and that they should get the child evaluated, because the child is not going to receive services if they're not eligible. I also just wanted to note that poverty and disability really create enormous stress on families, which really negatively impacts child development, which makes the work that we do with families that much more important. So sometimes when we're working as therapists, we really don't receive a thank you very often. So I just want to remind you all that you are awesome. The work that you do with families is so important, and I thank you. And I'm sure the families thank you, even if they forget to thank you when they see you. So the big takeaway is that for children with developmental delays, the earlier they receive services, then the less services that child will need. Here are some ways that you can stay current. And again, I will send out all of the slides. The Massachusetts Act Early group has a website as well as a Facebook page. And the CDC has a Facebook page called Milestones Matter. This is my email, and that is also the website for all of our recorded webinars. So I will go ahead and take questions, but thank you so much, everyone. This was great.